Manager for Nationwide Health Promotions with the American Lung Association, and will be moderating today's webinar. I would like to welcome you today to our webinar, Living Well with COPD, focusing on treatment guidelines and disease management of COPD. We appreciate you taking time to join us today to hear this valuable information. Today's webinar is possible through the generous support of Sanofi, Regeneron, and AstraZeneca. Currently, there are over 11 million people in America living with COPD and many more who are not diagnosed. At the American Lung Association, our mission is to save lives by improving lung health and preventing lung disease. And our vision is a world free of lung disease. We hope this webinar provides you with many different tools for managing COPD. Today's learner outcomes include ensuring you are able to identify treatment options available for managing COPD symptoms, having a better understanding of flare-ups, also called exacerbations, and how to avoid them, and finally, knowing where to find resources and support to help you manage your disease, no matter what stage you are at in your journey. Before we get started, I want to share a few housekeeping items with you. The recording for this webinar will be available for you to watch after today's live presentation. You will be able to access it through the link that you received from joining today's event. We will have time for questions and answers after we have heard from our speakers. Please put questions in the Q&A box, which can be found along the top of the bar on your screen. If you have any technical difficulties during the webinar, you can let us know in the chat, which is also along the top bar of your screen, and we'll try to assist you. And finally, there will be a brief survey that we ask you to complete after the webinar. The link to the survey will also be available or provided in the chat. We appreciate your feedback so that we can make sure we are providing information that is most helpful to those attending. I'm excited to introduce our speakers today. Today, we will start by hearing from Caroline. Caroline was going to share with us her story about living with COPD. We'll start hearing from Caroline. Dr. Lee has been held up, so we're going to swing right into hearing more about Caroline's story. So let me start by introducing her, and I'm just going to fast forward here to Caroline's slide so we can see what Caroline has going on. And Caroline, you're off on mute. Caroline, thank you so much for joining us today.
Thank you. I'm glad to be here.
Yeah, I really appreciate it. So Caroline is going to be sharing her story. She was diagnosed with COPD over 10 years ago. Caroline is a retired teacher who taught in the public school system and at the community college level. She also is retired from her work as a jewelry coordinator for Sears. In her free time, she loves to sew, crochet, and read. She also enjoys tending her flower beds and vegetable garden. Caroline is a member of the COPD Patient Advisory Group at the Lung Association and a COPD state captain for West Virginia with the COPD Foundation. At this time in her life, Caroline says that her reason for being is to help others with COPD lead their best life. Caroline, thanks so much, and we'll let you share your story.
All right. Well, thank you. Well, I guess we'll start back at what I call the beginning of when I started to think there might be something wrong with me. And then that Saturday morning that I decided, no, there's nothing wrong with you. You're just lazy. You need to get with it, girl. You need to quit being this way. And so I was in my family room, which is downstairs, and I thought, I'm going to start by how I go up the stairs today. I'm going to run up those stairs like I used to. So about 3 steps up, my feet felt like they were set in concrete, like they were so heavy that I couldn't lift them up. By the time I got to the top of the stairs, I felt like I was only breathing down to my throat, that nothing was going into my chest at all. And I was pretty scared because it's definitely frightening when you cannot breathe. And so the saying that nothing else matters if you can't breathe is absolutely true. So I managed to get myself to my cell phone, which I had not even taken with me down the stairs. And I was in a brain fog, probably due to lack of oxygen. And it was very difficult for me to remember what it was I was to do. I couldn't remember that number that I was to call. I couldn't remember, oh, you just dial 911. Well, finally, I did remember, and I dialed 911. And the ambulance came and took me to the ER. And in the ER, the young attending physician came in with two pieces of plastic tubing that looked like he was getting ready to plumb something in the bathroom. So I couldn't figure out what that was all about. And he said, ma'am, I'm not going to lie to you. This is really going to hurt, but we've got to put in a chest tube. Well, he wasn't lying to me. It really did hurt, but he was very good. He gave me instructions on holding my breath and gritting my teeth more or less and tightening up my muscles so that it wouldn't hurt quite so badly going in. I was suffering from a pneumothorax or a lung collapse. And this was the first of three of those lovely incidents that I would have. And I have not had one. I have not had a lung collapse for 4 years. And that's probably due to the fact that I did start to listen to my pulmonologist, who told me, you're too skinny. You need some insulation. You live at a high altitude, and so therefore you're at a higher risk of having a pneumothorax. You need to have some fat there for two reasons. One, you need that fat in order to bind you through the really rough spots of having a pneumothorax. And the second reason is skinny people are more likely to have a pneumothorax than others. Well, in my 14 days in ICU, I was diagnosed with COPD, and I was given two appointments, one to a cardiologist and one to a pulmonologist. And I did not keep either one of them because I said, I was in full denial. I don't have this disease. There is nothing wrong with me. I just need to get off my lazy bum and get with it. Well, that didn't work out so well. So whenever I lost my breath the second time with the second pneumothorax, I thought, well, you know what? I probably do need that appointment with that pulmonologist. So I made the appointment, kept the appointment, and I'm very lucky to have found a wonderful pulmonologist who's helped me through my journey with COPD. I became very despondent. I think I was close to being depressed. And I started looking for something to cheer me up. And I found two things that cheered me up. I found the American Lung Association, excuse me, and the COPD Foundation. Both of these sites gave me great incentive to go ahead and live a good life, that I wasn't doomed to die, that I wasn't doomed to be housebound, that I could have a life. I also, at that point, decided, you know what? I need to help other people. I've been through a good little bit here, and I think I have some experience that would help others. That actually was one of the most important things that I had decided to do, because once you start to try to help others, your problems seem a whole lot less. I have always had a problem knowing when I was sick. Was I sick or was I just tired and need to go to bed and go to sleep? The COPD action plan, or as my doctor likes to call it, the care plan, has helped me with this, because my care plan says if I am tired 2 days in a row, then I have to call my doctor. So this has given me guidelines. I guess I was one of those people who were brought up in the country where there wasn't a lot of emphasis on going to the doctor. You didn't go to the doctor until you could barely make it. And I really needed to rethink this, because we need to catch those exacerbations right in their beginnings, so that we don't do extra damage to our lungs. I am living a good life. I do almost everything that I ever did before, just a whole lot slower, but I can still enjoy my life. And I very much enjoy helping other people. And I guess that's about it.
Caroline, thank you so much for sharing your story with us. I really appreciate it. It's really helps us see what your journey was like. I'm sure touches a lot of other people as well. So thank you so much. Caroline's going to be staying on, so if you have any questions, she'll be waiting in the background. So you be sure and put those in the Q&A if any questions come up. And I'm just going to get us back to the right part of our presentation here to get us back on track. And Caroline will get back to you later on in the presentation. Thank you so much.
Thank you. Thank
All
you.
right. Welcome. And sorry, I'm just going to kind of scoot through the slides. So our Dr. Lee will still be joining us. He got caught up, as often happens with doctors, so he'll be with us shortly. So before we dive into Dr. Lee's presentation, I just want to share with you some resources that we have at the American Lung Association, so that you know what is available to you. At the Lung Association, we have several free support options that are available to people living with chronic lung disease. It is important to find support that is right for you. Our Better Breathers clubs are support groups that meet in person or virtually, providing both educational and support opportunities, and are led by facilitators trained by the American Lung Association. Clubs are listed on our website. And also our some of my team members can always add in the chat the link for that as well. You also can find out how to become a facilitator and start a club in your community if you're interested in hosting a club. The Patient and Caregiver Network provides you direct access to education, support, and connection to others also living with lung disease. And our lung helpline is staffed with lung experts who can answer questions related to financial assistance, oxygen therapy, resources, and more. We also have lung health navigators, which I will talk about more in the upcoming slide. Finally, you can find online peer-to-peer support communities on the Inspire Living with COPD community or Living with Lung Disease. There's actually quite a few living with various lung disease communities on the Inspire. I briefly mentioned the lung health navigators on the previous slide. Our navigators are trained specialists, including respiratory therapists and registered nurses. This free service gives you the opportunity to talk one-on-one with a navigator to help ensure you have a good plan in place to best manage your COPD. The navigators will set up times that work for you to chat on the phone or by Zoom to work with you or your loved ones and your loved ones to help provide you with resources information. You also will be sent a free Learning to Live with COPD workbook that is a comprehensive guide and educational tool for living your best life with COPD. We also have many resources you can find on our website at lung.org/COPD. You will find educational materials such as our COPD Basics booklet or COPD workbook to better understand treatment options and disease management, as well as helpful forms to print and use in your daily life, such as our COPD action plan. And maybe Bev or Nicole, you could put those in the chat as well. All right. Next up, if I can just have Bev join us momentarily and share a little bit more about the COPD Basics booklet. I'm just going to pop over to that slide and the workbook real quick. That would be lovely.
Yeah, you got it. And thanks so much for your patience, y'all. We really appreciate you. Here's one of the really cool things that I like about the COPD Basics workbook. It is handheld, it's kind of like the size of a book, and there are resources that are directly available to you. We tried to make them simpler language to try to get rid of all that jargon that tends to confuse us when there's a lot of medical terms that aren't so easily to understand. There's also some really cool resources in there uh, that link to the resources that are in the Lung Association website. This is also true for the workbook. And maybe I should mention just one more time what the differences are. The Learning to Live with COPD workbook is like, if you want all the information in printed copy. And remember, Jen said that you can get that delivered to your mailbox if you connect with our lung health navigators and join our Learning to Live with COPD course. So that's one way to get a free copy mailed to you, but it's also available free to download on lung.org. And we'll make sure to put that link into chat for you. I think that it's really important when we talk about COPD to talk about how useful it is to really understand what's going on with your lungs specifically so that you can have a conversation with your doctor. And sometimes these words, even understanding what chronic obstructive pulmonary disease is, whether you have emphysema or chronic bronchitis or both, can be confusing. And so the Lung Association has resources to help illustrate that through animations. We link to those in the COPD Basics workbook and also the Learning to Live with COPD. So we absolutely encourage you to check out all of these resources and also reach out to us. If you can't find what you're looking for, there's a good chance that it is available. But if it's not, we want to know what it is that you're looking for to make sure that you're getting what you need. So I encourage you to reach out to the Lung Association if you don't have what you need and check out these great resources that are currently available to you.
All right. Thank you so much, Bev. That was very
Sure.
helpful. Awesome. All right. Well, I'm excited to introduce to you now Dr. Jordan Lee, and I really appreciate your patience. Like we were talking about, doctors get held up sometimes. So thank you so much for waiting for Dr. Lee. Dr. Lee, I know you were able to hear some of Caroline's presentation, so that's awesome. But let me introduce Dr. Lee. Dr. Jordan Lee is a pulmonologist and critical care specialist at the Queens Medical Center in Honolulu, Hawaii. Dr. Lee was born in Hawaii, grew up in Iwa Beach, and graduated from the University of Hawaii, Manoa John A. Burns School of Medicine. It means a lot to Dr. Lee to be able to give back to his underserved Native Hawaiian and Pacific Islander communities through his work. As part of the pulmonary and critical care team at Queens, Dr. Jordan is focused on providing compassionate, evidence-based medicine and patient-centered care with aloha. He is driven to make a difference in the world, starting with his patients' lives and well-being. Dr. Lee also is proud to be an educator teaching comprehensive pulmonary and critical care medicine at a premier academic teaching center. Dr. Lee, thank you so much for joining us today.
And thank you so much for having me, Jennifer. And thank you so much, Carolyn, for sharing your story and your journey. I know it's really difficult for a lot of my patients with COPD, living on the day to day, just trying to get by and kind of live with their chronic disease. So, again, thanks everyone for being flexible. Sorry I got tied up with something in the hospital. So, let's go ahead and get started. I want to respect your guys' time. I'm going to take over. Let's see. All right. All right. So, here we go. Okay. All right. So, what is COPD? So, you probably already heard from Jennifer and you probably already heard from Carolyn, but a quick overview of COPD. It's an umbrella term that includes both emphysema and chronic bronchitis. So, these are two entities under the COPD terminology. So, emphysema basically talks about enlarged airways and air being trapped in those air sacs at the end of your lung sacs. And the second part of COPD is chronic bronchitis. So there's a lot of airway inflammation and mucus production in the lungs, in the airways that causes a lot of coughing and the typical COPD symptoms. Some of the goals of management for COPD, we want to slow the disease progression down. Secondarily, we want to better control symptoms. Third, reduce the risks of flare-ups. Fourth, decrease hospitalizations. And finally, improve the quality of life. As Carolyn mentioned, you have to live with this new disease. So we want to be able to understand the pathology and then also how to adjust and how to improve your day-to-day quality of life. How do we manage your disease? So the first line therapy for COPD is that we have two types of inhalers. So the first ones are quick acting. We call these short acting or relief or rescue inhalers. So these are things that you probably heard about, albuterol or Proventil. These are inhalers that give you quick relief and open up those airways so that you're not having so much shortness of breath or wheezing. The second ones I will talk about a little bit more. These are long-acting inhalers. These are your daily COPD maintenance inhalers. So in the airways, there are three different pathways through which the lungs kind of operate. So there are three mainstays to COPD. The first line therapy for COPD treatment is a long-acting muscarinic agent. These are inhalers such as Spiriva, you may have heard of. The second line is usually a long-acting bronchodilator. And these usually come in the form of basically a longer acting albuterol, giving you kind of longer control and opening of airways. And third, because there is a component of because there is a component of inflammation, inhaled corticosteroids are also deployed as part of our regimen. So usually if patients come in and they're diagnosed for the first time with mild COPD, we usually start them on just a single long-term or long-acting inhalers such as Spiriva. As they progress further down their disease or they have diagnosed with moderate to severe COPD, we may want to start them on a dual agent. And sometimes if they have frequent exacerbations, according to the GOLD, those are our national guidelines, the GOLD guidelines recommend that we start them on triple therapy. And everyone will be different. So again, it's very important for patients who have COPD to discuss their options with their healthcare provider. And we kind of walk through the different risks and benefits of each inhaler and kind of adjust based on patients' needs, patients' tolerance to different inhalers. Sometimes patients don't really tolerate powder form. So we adjust just so that patients get the appropriate medicines at the right time. So again, talk to your doctor about any new medications that may be right for you. You also want to talk to your doctor about any new medications that were added by other specialists or your primary care physician. Sometimes medicines such as heart medicines can actually affect the lungs as well. They can actually be counterproductive to airway breathing. So you may want to let them know if you have any changes just so that they can note that as well. And secondarily, know how often to check in with your healthcare provider for your COPD. On average, when I see my patients with pretty well-controlled COPD, we see them every 4 to 6 months to check in. And obviously, if things are not good in between or in the interim, we obviously have them come in sooner or discuss over the phone. Third, find out how often you should practice using your medication delivery device with your doctor or pharmacist. For me, this is always a first time encounter. When I meet a patient for the first time, doing a first consultation, part of our workup and getting to know each other is to understand how they do their inhaler technique. So I like to have them practice and show me before we finish the visit. And last, ask your doctor if clinical trials would be right for you. So there's always some exciting new medicines or new trials or new interventions that are on the horizon and are studied. There also are trials to verify that the current medicines that we are using right now are actually tried and true. So always ask your doctor if they're aware of any clinical trials that may be going on for COPD. Treatment. So above or beyond inhalers, we may also employ supplemental oxygen. So if patients require additional oxygen, if their oxygen saturation drops below 88%, for me, I usually tell our patients that the goal oxygen saturation during rest and during exertion is usually 88 to 96%. You don't want it too low or your body can not get enough oxygen to the vital parts of their body. And you don't want it too high because the brain may be tricked into thinking that your breathing is fine and you may have 100% all the time with too much oxygen and your brain forgets to breathe, and then you hold on to too much CO2, which happens when you have emphysema and the air gets trapped in your lungs. So always a nice balance. So I always tell patients with COPD to kind of shoot for 88 to 96%. Secondarily, other treatment options include antibiotics. So typically patients, because of their chronic bronchitis, chronic inflammation, may have low-grade infection going on. So we usually treat when they have exacerbations, a short course of antibiotics, usually 5 days of azithromycin, it's also called Z-Pak, and also 5 days of antibiotics to cut down that inflammation and infection. And lastly, I can't stress this enough. So vaccinations are very important. So every time someone with COPD gets a really bad cold, such as influenza, flu, or COVID, or in recent years, we know that RSV, respiratory syncytial virus, causes a lot of lung damage. Every time you get sick, patients with COPD, their lung function actually goes down to a new baseline and does not fully recover. So the best thing that I can tell my patients with COPD is, one, please take your inhalers. Two, exercise, eat well, and third, make sure to get their vaccines. So every year, every visit, we always remind them to please get their flu shots, their COVID boosters, and also their RSV shot as well. So I'm going to switch gears a little bit. So patients who have COPD may also be candidates for this other type of treatment. It's called an endobronchial valve treatment. So basically, when the air gets into a COPD or emphysema lung, the air gets trapped in those alveoli, as I mentioned on the first slide. And when they do that, actually, we call this hyperinflation or air trapping, and the air gets stuck there. So the lungs that are damaged actually become bigger and bigger and bigger, and actually cause patients with COPD to get a barrel chest. When that happens, the good parts of the lungs are actually squished down. So it takes over, the bad parts of the lungs take over more of the chest cavity, and the good parts of the lungs get squished down and are unable to do proper gas exchange. So what this treatment does is basically a one-way valve that reduces lung hyperinflation, particularly with those patients who have emphysema in the upper airways. So in the upper lung fields, they go in through a minimally invasive procedure called a bronchoscopy. You go to sleep and they put a breathing tube into your lungs, like a mechanical ventilator. And during that, they put in a bronchoscope and then deliver these one-way valves that basically allow air to come out, but not go back in. So the air comes out of those hyperinflated lung sacs and then shrinks to the point that it gets really small so that the lung can redistribute to have a better ventilation and perfusion matching. And this can actually improve lung function and quality because, as you know, the bad parts of the lungs are basically cut off, and then the good parts of the lungs are left to do the proper gas exchange. So that's one intervention that is available to patients with moderate to severe COPD with an upper lobe predominant emphysema changes. Similar to this is lung volume reduction surgery. This has been around for 10, 20 years. This is obviously much more invasive and much more risk are involved. So basically with those bad parts of the lungs, such as the emphysematous changes or those with bulla, those are big damaged holes in the lungs, are resected or cut out from the chest cavity. Those, as I said, are big surgeries, and there are definitely risk and benefits for doing that as well. And finally, there's really no technically cure for lung COPD at this time, but there's one treatment that is available to select patients who meet criteria for severe COPD and have good um, performance status and also other criteria is lung transplant. So lung transplant is a surgical procedure, but obviously that is a very involved process that involves matching and multiple evaluations at different centers. It may require patients who have COPD to relocate to a different city as well. And the post transplant phase is always riddled sometimes with complications from surgery or from infections, because a lot of patients after you go on transplant have to be on anti-rejection medicines for the rest of their life. So these are very big options, but they are not without any risk. So just other things to talk about in terms of treatment. So beyond medications, taking control. So day to day, what should we do? So know your symptoms. So COPD, you're living with COPD. What are my day-to-day symptoms? How often am I coughing or wheezing? What is my mucus like today? How do I normally move? How often do I have to rest and take a break? These are things you want to keep track of and kind of maybe make a mental note or either a daily journal. And then I usually have our patients bring those journals to me or either kind of summarize it when they come to see me. How do I feel different during the different times of day? Is it worse in the morning? Is it worse at night? Is it worse after I eat? Is it worse after I lay down? Those are things that are very important as healthcare providers to know from our patients. One of the things that you can do, and this is available on our American Lung Association website, is download a COPD action plan. And as you can see by the Likert scale, you have the happy face, the okay face, the yellow face, and then the sad face, the red face. And that basically just walks you through how you feel at that time and what you should do to prevent getting worse. So if you're feeling good, make sure you maintain certain things. Make sure you keep taking your inhalers. If you're not feeling so well, again, maybe you want to reach out to your healthcare provider, whether that be your PCP or your pulmonologist. And if you're not doing really well, again, you must want to have an action plan to either go to urgent care or to the ER. But these are helpful kind of reminders to keep track of on a day-to-day basis, to keep track of what your COPD is like. Know when your symptoms change and what to do. So again, going back to that COPD action plan, you want to keep track of your symptoms on the day-to-day basis or even week to week if you're very busy. Know your action plan and what to do if things get worse. Again, sometimes some of my patients, they do have an extra set of rescue medicines at home. These are emergency medicines, such as, like I mentioned before, like a few days or 5 days of antibiotics or steroids. But again, we don't want to be dependent on those because those have a lot of side effects too. But I also, I do work remotely in a part of Hawaii where some of my patients, they are 2 hours from their nearest pharmacy. They live up in the volcano area. So for those patients, we have a discussion about having a set of emergency medicines just to have at home, just in case things get really, really bad. Again, you want to have contact with your healthcare provider sooner rather than later. You want to catch it before it gets worse. And please don't wait. All right, so empower yourself with knowledge. So talk to your healthcare provider. Again, we're here to help and we want to learn from you and help you. So again, there is no shame in letting your healthcare provider know how you're feeling, what's your day-to-day like, what's your struggles, what your baseline activity level was last year versus today. These are things that are helpful for us to know what has changed and how can we help. Secondarily, you want to attend pulmonary rehab. So In most places, there are rehabilitation centers. So kind of like your physical therapy centers, these are rehab centers that are particularly focused on pulmonary disease. So those patients with COPD, pulmonary fibrosis, even sometimes patients with asthma, but more so the COPD and pulmonary fibrosis. So they help patients kind of learn about their disease, how to conserve energy and do movements without having to expend so much energy and oxygen. And they also teach you how to do proper breathing. So COPD, I usually tell our patients to do slow, deep breaths, and then with pursed lip breathing to help kind of peep open your collapsed airways or obstructed airways to let the air out. Third, you want to ask your pharmacist. So they're also a very key player to your healthcare. So they're able to answer questions about different inhalers. They have the capacity to show you how to do um, proper inhaler technique. And finally, that's also a place that a lot of patients get their vaccinations. So keeping up to date with their vaccinations, again with flu, COVID, RSV, those are your big ones, and their pneumococcal vaccine as well. And then finally, visit your trusted sources for information. So American Lung Association, COPD Foundation, those are excellent resources to have to learn more about your disease. Again, pulmonary rehab, like I said, they provide education and exercise program for each patient that is tailored to each COPD patient. They learn to better manage their shortness of breath, how to compensate, how to recover. They have group settings that provide opportunity for peer support and support groups. And finally, they're facilitated by a team of health professionals. So not only is there usually a health care provider such as a physician or a nurse, but there's also physical therapy, occupational therapy, speech therapy. Those are great resources to have as COPD patients. Another big component that I always ask our patients is please to quit smoking. So it's an important part of your COPD treatment plan. A lot of times, patients with COPD are previous or current smokers. It's not to say that all patients with COPD get or are smokers, but the majority of patients with COPD have had some exposure to smoking, whether that be passive or active. So growing up in a household where your parents or your siblings or your partner smoked, that also can affect your lung health as well. So we always emphasize to patients who have COPD to quit smoking. And we have a lot of good resources out there to quit smoking, such as lung.org / quit smoking. You can join a quit program. There's the lung help quit line. They can provide resources, whether that be through counseling and or nicotine replacement. Again, the chemicals in cigarettes and e-cigarettes and cigars can further damage your lung and cause more symptoms over time, which can then lead to more exacerbations and then decrease your lung function going forward. And again, it's always good to um, maybe you don't have to quit alone. So if your partner is smoking as well, you can get on the bandwagon together and try to encourage each other to quit together. So that's always helpful if you can get your partner to quit smoking as well. That will, one, reduce the amount of secondhand exposure, and two, improve your lung health for both of you. Next slide is palliative care. So supportive care for all stages. So a lot of times I do need to clarify with patients, and I see a lot of this since I work in the ICU as well. So palliative care is a type of medicine that provides specialized medical care for people living with chronic or serious disease. They also focus on patients who have terminal disease. Not all palliative care is hospice care, but that is one facet of palliative care as well. Again, the focus of palliative care is that they want to, one, improve your condition, two, manage your day-to-day symptoms, and three, honor your treatment goals and your goals, your life goals, and even your end-of-life goals as well. So again, if this is something that is interested to you or you're interested, you may want to talk to your healthcare provider to talk about palliative care if they're available in your state. Okay. So early delivery of palliative care reduces unnecessary hospital admissions. So the focus again here is for patient well-being and quality of life, and not for excessive, invasive procedures. So again, palliative care is for supportive care for all stages of COPD. But a lot of times, like I said, we do employ palliative care to talk to patients who have moderate to severe or even end-stage COPD. So complementary therapy, so improving other parts of the quality of life. So these help to manage the side effects and symptoms, reduce anxiety and depression, help with breathing techniques. And these interventions may include massage, yoga, acupuncture. They may not particularly treat the exact pathophysiology of COPD, but they can, again, improve the quality of life, living with day-to-day COPD, the stresses, the anxiety, the depression, um, the, uh, the shortness of breath that you may experience. So these techniques can help kind of calm the mind and give you better quality of life as well. So exacerbations or flare-ups. Again, since we are keeping track of our day-to-day symptoms with our COPD action plan, you want to recognize how you feel on these quote unquote normal days, but you also want to recognize when you have common signs of COPD exacerbations or flare ups. So these are more frequent coughing or more severe coughing, difficulty sleeping, a change in the sputum. So if your sputum is usually white or clear and it's starting to turn yellow, green, or brown, you should probably contact your PCP or healthcare provider. If you have increasing shortness of breath, wheezing or noisy breathing, and you feel more fatigue. So these are signs, symptoms of oncoming COPD flare-up or exacerbation. So what to do? So you want to avoid COPD triggers. So smoke, strong odors, air pollution, respiratory infections, and other things. Second, you want to follow your COPD action plan. So the plan should include steps to do or steps to take when your symptoms worsen. And third, do not wait to act on change in your symptoms. Please notify your healthcare provider immediately. Again, you want to act upon this sooner rather than later so that you don't end up in an emergency situation. And again, this is a chronic disease. So COPD, again, that includes emphysema and chronic bronchitis, is a marathon and not a sprint. So you want to take control of it over time, and it's not going to fix it in one day. So again, just keeping that in mind. Again, this is about the whole patient experience and living with COPD and how to adjust your life to COPD. So what can you do day to day? So follow your treatment plan, visit your doctor regularly. Again, I like to touch base with our patients every 4 to 6 months with COPD. Eat nutritional food. I like to tell patients who have underlying inflammation and chronic inflammation that a good thing to do is maybe do some low inflammation, low inflammatory diets. So these are like Mediterranean diet is one of the examples that I use. A lot of fish, nuts, and greens are very good. You want to stay active, but again, you don't want to push yourself too hard, but just a minimal amount to where you're comfortable with. Just to stay active, keep the blood flowing, keep your muscles active, and your lungs and heart healthy is very important. Next, you want to implement an energy conservation technique. So then these are things to plan ahead if you live on an incline at home or if you have stairs, just to plan accordingly so that you don't tire yourself out or pass out when you're going upstairs or transferring to a toilet or going into the shower. Things are important so day to day you protect yourself from any kinds of accidents. And again, please take care of your emotional health. So talk to your family, talk to your friends, reach out to support groups, employ some of those techniques such as massage and acupuncture. Those are all very important for your lung health as well. And I just mentioned this before, but again, there's a little bit more detailed information on our American Lung Association website. So what you eat may affect your breathing. A healthy diet has lots of variety. Work with your healthcare provider to find a diet that is right for you. And again, there's more information if you go to our website as well. Some of the benefits of exercise. So the right amount of activity has many, many benefits. And I tell my patients who are afraid to move that it is still okay to remain active. And everyone's definition of active just depends. So you want to talk with your healthcare provider to start an exercise program that is safe and effective and still can give you the benefits of exercise as well. So moderate exercise, as you may know, can improve self-esteem, the body's use of oxygen delivery, your energy levels, your endorphin levels, so you feel less stress, less anxiety, more power, more happiness. It will improve your sleep, and again, it will help with your shortness of breath, your muscle strength, and also helping out our heart as well. This is a little trick that I like to also share with my patients with COPD. So remember the 5 Ps, especially when you're doing exercise. So pace yourself. So again, it's not a marathon or it's not a sprint. It's a marathon. So you want to just go slow and pace yourself. Second P, you want to plan ahead. So if you know you're going to have a long, busy day, going to various doctor's appointments, or it's going to be really hot outside, just plan accordingly so that you don't burn too much energy and oxygen. Third, you want to position yourself. So sit when you can. So make sure you have places around the house or places on your route for the day so that you can able to sit down, catch a breath, whether that be in a bench or if you have a walker or if you are carrying your portable oxygen, make sure you have a place to kind of position yourself, sit upright. Some patients actually improve their symptoms by kind of leaning forward and doing a little tripod position to help kind of prop open the lungs. And four, you want to prioritize. So make sure what things you need to be done are done first, and other things can wait till later. And I mentioned this before, but pursed lip breathing, so kind of like breathing through a straw, or pursed lip breathing is an effective way for patients with COPD to basically help open up those obstructed airways in your lungs and let the gas or the carbon dioxide out. Emotional health. Again, I can't stress this enough. A lot of patients with COPD, they feel isolated, they feel alone, they feel shocked by their diagnosis. So it's very important when you are diagnosed with COPD to also take care of your mental health. So that's recognizing what anxiety, panic, depression can contribute to your feelings of shortness of breath. You want to talk to your healthcare team. Here at Queens, we like to utilize a lot of our integrated physician network. So we have social workers, we have nurses, as well as pharmacists that help me with my COPD program. So in between our visits, I have this multidisciplinary team that is checking on my patients to tailor each of them for their specific COPD needs. You want to incorporate strategies to cope with COPD. Again, it's very helpful to connect with others who understand what it's like to live day to day with COPD as well. And finally, you want caregivers to recognize that caregivers also need support as well. Again, patients with moderate, severe, and even end-stage COPD, uh, they usually require a lot of help to get around or even carrying their oxygen tanks and their wheelchairs. So again, recognizing that your caregivers may need some support as well. So tips for caregivers. So talk about your role with your loved ones. Accept the different emotions you have that come with caregiving. Have someone you can confide in, and take care of your physical and emotional health and get support. So again, I can't stress this enough, but a big, big thank you to those who provide care and 24/7 care for our patients with COPD and anyone with chronic disease. It does take a lot. It takes a lot of heart, takes a lot of emotion, and takes a lot of strength, both physical as well as mental. So make sure you take care of yourself as well. And that's it for my part of the portion, my part of the talk. Again, my sincerest apologies for missing the first part, but I do want to say thank you again so much, Jennifer, for allowing me to be here today, and also Carolyn for sharing your story. I got to take a listen to that as well. So thank you so much.
Well, thank you. Thanks so much, Dr. Lee. And we have a little bit of time for Q&A. Before we do that, thank you again for that wonderful information. Very useful, very helpful. Um, but please be sure and take our survey so that we know that we are meeting your needs and we can help form our programs that we offer in the future. It's very helpful for us. And the link is also going to be put in the chat. But let's get to our Q&A. And Caroline, let's start with you. We had someone ask if you could share one or two ways that you're able to make an impact on other people's lives. So I know you are involved in lots of different things, but maybe if you could share one or two things that you feel like you're able to make an impact in other folks' lives that are living with chronic lung disease.
Well, I think one of the most important things is that I can just be there to say, you're not alone, because it is a very isolating disease.
Mm.
And so just to be in contact with someone who has the same problem, or maybe not the exact same problems, but I have the same disease, then just to say, hey, it'll be okay. This is not a death sentence. There are things that you can do. And it's very important for you to take part in your care. And I think that's two of the ways that I can be impactful in someone else's life to help them along.
Very true. Yeah, thank you. Thanks for sharing that. Dr. Lee, someone asks, is there a typical length of progression for COPD from onset to more severe disease, or is it highly individual?
That's a great question. So to answer that question, yes, it's very highly individual. So some patients, like I said, with COPD have been lifetime smokers and they have mild COPD. And I've seen them over the years since I've been in practice and they haven't changed. I have other patients who smoke for maybe 20 years and maybe had some occupational exposures either from cooking or from asbestos or something. And their disease will progress much faster than that a lifetime smoker who I've had. So everyone is very different. And that's why it's so important that you are honest and upfront with your provider to know exactly what your needs, what your limitations are, and to get those lung function tests. I wanted to also stress that it's also important for a lot of patients with COPD, if they had exposure to smoking or if they have smoked in the past, that part of their workup in seeing a pulmonologist is that they will also most likely recommend a low-dose CT scan to look for lung cancer screening. And November is lung cancer awareness as well. So a lot of times our patients with smoking history, if they meet the criteria, so that's ages 50 through 80, with a smoking history of at least 20 pack years or actively smoking or quit within the last 15 years, you are eligible and covered for a low-dose CT scan. One, to look for lung cancer, lung nodules, but also we can also radiographically see whether or not you do have emphysema, COPD, kind of dilated airways as well. So that's very important for patients when they come and see me to individualize their treatment plan based on how they feel. So yeah, there's not a typical progression, but I will say that everyone, no matter what, as we age, our lung function does slowly go down by 1 to 2% every year, but everyone progresses at a different rate with COPD. Great question.
Okay. Yeah, great. Thank you so much. And thanks for pointing out that it is also Lung Cancer Awareness Month and low dose CT scan. Thank you so much. That's very important for folks to know. Caroline, someone was asking how you developed your plan with your pulmonologist, your action plan. Did you bring that in with you and actually sit down with your pulmonologist when you came up with your care plan?
Well, I came about this probably in an unusual way. My pulmonologist gave me I was a former teacher, so he gave me an assignment. He told me to check out the American Lung Association's website, that they had a special section on COPD, and to go to the COPD Foundation website. And I had complained to him that I was sleeping a lot lately, so he gave me another another assignment to read the Reader's Digest article that that came out that month, I think, on sleeping. So gosh, I've run my mouth now. I forget what my question was.
So did you developed your COPD
Oh,
action
oh, oh,
plan?
oh. Okay. So the at this point, I'm going back to see him. Seems like every 2 or 3 weeks. Anyhow, at my next visit, uh, I had found the action plan, and I had made a copy of it because that's what it suggested that I do, and I took it with me to see him. And that's when we made some changes to mine. That it's not the generic anymore. It's specifically tailored to me, which I think is very important.
It is. It is good. Awesome. Thank you so much. We have a couple minutes left. Dr. Lee, what do you think about an anti-inflammatory diet? Is it
Oh,
a good thing?
I think that's a great thing. So again, a lot of what the old adage is, we are what we eat, right? So if you eat a lot of high inflammatory foods such as fatty fried foods and a lot of spicy foods, and even those foods that can cause some irritation in your gut lining, you may actually cause some acid reflux as well, and that may lead to some silent aspiration and some like exacerbations too. So I usually recommend to patients with COPD and any types of chronic inflammation diseases such as lupus or idiopathic pulmonary fibrosis to maybe consider going to a low inflammation diet. So again, Mediterranean diet is one of the well studied and effective low inflammatory diets. So again, a lot of nuts, olive oil, fish, poultry, and greens are very good. So if you can somehow incorporate that into your diet, that'd be excellent. I know right now everything is so expensive in our economy, but if you can implement some pieces of that into your diet, avoid some of the fast foods, that would be very important as well.
Okay. Thank you so much. All right. Well, I want to thank everyone for joining us today. I want to just be mindful of everyone's time and our guest speakers. So thank you, everyone. Caroline, thank you so much for taking time out of your busy schedule. And Dr. Lee, you as well for taking time out of your very schedule, and everyone that was able to join us. Just a reminder that you will have access to the taped webinar. And we also will be sending out a follow-up email, and it will have a link to the survey and a link to the different resources that we talked about today. So if you didn't catch everything as we were talking about it, we will have links to all of that as well. And then my email will be on there as well. So if you have any questions, you can let me know. So thank you everyone so much for joining us.